Hello everyone, welcome. And today we are going to talk about diabetes. Diabetes, did you know, is one of the biggest disease today, that there are around 500 million cases all over the world today. And India has the highest incidence of diabetes all over the world. It is estimated that at least 1 in 5 patients that we see today are diabetic. So we understand the gravity of this disease, diabetes, and how often it is seen in our practice, and how important it is to learn this disease and to know how to handle this disease, because without knowing diabetes, obviously we are going to miss a large part of our practice, a large number of patients. So how to manage diabetes?
Yes, Dr. Shrikant, and to know how to handle diabetes, how to manage cases of diabetes, it is very important to learn what diabetes is clinically. Let me give you an example. One of my friend's cousin was obese and he was having a black discoloration on his neck, and he was taking many remedies for it, including my treatment, and that black discoloration was not going off. But somehow one day from my clinical teacher I learned that this is actually acanthosis nigricans, and this is a sign of pre-diabetes. After this, I actually investigated this patient for pre-diabetes and I found that he was pre-diabetic. This helped me to manage this case much better. And like this is pre-diabetes, this was one example. I should say there are different stages of diabetes. There'll be newly diagnosed cases, there'll be chronic cases, there'll be uncontrolled diabetes, there'll be complications, and what to do in each of these we should know clinically.
So you mean that is the first thing that we should know, that how to clinically identify these patients so that it will help us
Yes,
to
yes,
manage
yes.
them better. I think this is very important, Dr. Gitesh, because I want to share one of my experience from handling chronic uncontrolled diabetes. You see, majority of our patients that come for us for diabetes are patients who are already taking allopathic medicines, but either the diabetes is not under control or the patient is not feeling symptomatically better. That is when they are coming to us. And in a large number of these patients, I observe that, um, with the correct homeopathic remedy, there is a good and a very significant amount of difference in their overall health, in their symptoms, in their well-being. But I felt, the change in their blood sugar level was not, as expected. It was not like, okay, the remedy has worked for the symptoms as well as for the blood sugar level. And that is when thoughts started crossing my mind that maybe we need to also give some local remedies or even mother tinctures to control the sugar level, because the patient is doing better symptomatically. But it did not work so much for me, to be very frank. And that is when, why while I was trying to explore what is missing, one very important thing I realized is the importance of maintaining factors like the other allopathic medicines the patient is taking. And many times identifying those and modifying or getting rid of them has really helped to manage the sugar level as well, along with these symptomatic medicines. So which remedies to do this, how to reduce them, how to increase them, how to do all this is something that we really need to learn, is one more very important
Yes,
thing
yes.
that I
Yes. I totally agree, Dr. Shrikant, that knowing these medicines and tweaking them a little bit here and there is very important. But I also feel there's one important point that most patients ask, even some doctors ask, what diet to take, what exercise to do. And there are so many standard instructions that are already there in the medical world today, that this diet, this kind of diet should be followed, this exercise. For example, everybody is told to walk 40 minutes. Walk 40 minutes every day. Walk 40 minutes.
Or
But
don't eat sweets.
Yeah, and everybody doesn't like to walk so much, or some people are not even able to walk for 40 minutes daily. What to do in such cases?
Yes.
That's a big question.
So, questions like these, like one more question that comes to my mind is how to manage complications. There are dangerous complications of diabetes, like we have diabetic foot, there is diabetic gangrene, the foot gets amputated, or there is diabetic nephropathy where patient kidney is not functioning, patient is asked to go under dialysis immediately. How to manage these cases? When I started, I was a little bit anxious. Should we even take such cases? Can we as homeopaths help such severe complications of diabetes? And I think we can definitely help, but the important thing is we should know what to do. Like you initially said, it's very important to first know clinically that what is the depth of the pathology and how much time do I have, what kind of remedies can I give, what kind of auxiliary measures can we suggest, how much can we wait, how much risk can we take, how much we cannot wait. I think things like this we should very clearly know so that we are able to take up such complications also of diabetes. And this is what we all really need to know, is what I felt. So
so there are so many questions about diabetes in the minds of so many of us, including doctors, patients. And to answer most of these questions, we are coming up with a course on management of diabetes with homeopathy, and this is going to happen live at Prana after 2 long years. We are having something live at Prana, and it will be on the 17th of April and 24th of April, 10 a.m. to 5 p.m. full day, and it will also be on the 5th of June, again 10 a.m. to 5 p.m. full day, and on 5th of June we will be having one of the legends of homeopathy, Dr. Farokh Master, with us. And I would like to welcome all of you to this course. See you all.
See you all. Thank you. Bye-bye.
Bye.